Greetings and welcome.
Welcome.
You're watching this DVD because you are probably faced with losing a tooth. This may be new to you, or you may have had this procedure before. However, we feel that if you know about this procedure as much as you can and prepare for it the right way, you will have the best possible outcome. Your practitioner can do this procedure in a number of settings. We'll discuss this shortly. We'll go through the consent issues as well, that is, things that can go wrong. And most importantly, we'll advise you on the best post-operative care.
And furthermore, we'd like to just discuss at this stage, before your actual surgery, the treatment options afterwards for replacing your missing tooth or teeth. So essentially, you could do nothing, but that will have a number of consequences, or you could consider a partial denture, a bridge, or an implant solution.
We feel that by having the patient informed prior to the procedure, patients feel more confident about the procedure, there's less stress involved, and there's also less stress involved for the practitioner, because the patient is simply less anxious and also more informed about the options for afterwards. There are still many reasons to face loss of a tooth. Modern dentistry and medicine has been very successful preserving teeth. This is done with proper use of antibiotics and extensive dental treatments. However, at times there may be no other choice but to remove the tooth. The simplest reason is simple trauma. When the tooth gets fractured, for example, below gum line, restoration can be very difficult for your dental practitioner. Sometimes the tooth may be completely avulsed and it will die and not be able to be reimplanted. Simple decay is another reason. This is becoming less common with fluoride and other treatments and careful dentistry. However, it still occurs, and then the tooth may need to be lost and removed to prevent other troubles. In terms of periodontal disease, this is regretfully becoming more common as we live longer, and bone loss and gum loss around the support for the tooth leads to mobility and eventual loss of a tooth, which may be completely intact. Sometimes teeth have had the maximum treatment. They may have been damaged at some stage, had fillings, had root canal fillings, had crowning and post and core restorations, and at some stage they become brittle, or some form of infection has spread to the surrounding tissues, most commonly underneath the tooth, and extraction or surgical removal of the tooth becomes necessary. At the end of the day, there are regretfully reasons to remove teeth to prevent further troubles for the patient.
Now, the next option you have to think about is whether this treatment will be performed by your general practitioner or by a specialist. Often this decision hinges on your level of anxiety. Local anesthesia treatment can be provided by both the general practitioner and the oral maxillofacial surgeon. However, often it is easier for the specialist to offer you treatment under either IV sedation or general anesthesia. So if you have previous bad experiences with extractions, or if you're highly anxious about the proposed treatment, then treatment under sedation or even full general anesthesia is a very real option. Your dental surgeon will discuss these options with you.
Your practitioner, be it your general dental surgeon or your oral and maxillofacial surgeon or your specialist in other specialties such as periodontology, etc., would have performed the procedure, that is surgical extraction or extraction of teeth, many times, sometimes hundreds and thousands of times. However, there are issues with all procedures and small risks that you need to be aware of before permitting this procedure, before consenting for this procedure. You have to understand that with any procedure there will be swelling afterwards. We tell all our patients that they will be swollen for up to a week after the procedure. This obviously depends on your particular circumstances, the difficulty of the surgical extraction or simple extraction. There will be some degree of discomfort, but this should not be excessive. Often you'll be quite numb after the procedure, after local anesthetic injection, and this is the time to take your painkillers, so pain is usually not much of an issue. Rarely infection can develop. In some cases your practitioner may give you antibiotics before or during the procedure. There are, however, also anatomical issues that need to be understood. In the top jaw, essentially we don't have any significant nerve endings, so numbness is not an issue. However, in the top jaw, the one particular risk is the maxillary sinus, which is a cavity above teeth, especially the back teeth, and sometimes roots of these teeth can actually go into the sinus, so removal of the tooth would result in a hole from the mouth cavity into the sinus. If this happens, often it needs repair because fluids and food could leak into the sinus and cause infections. Apart from this, in the top jaw, the only other significant risk is the risk to other teeth. Sometimes teeth have got large restorations or may be very brittle, and occasionally a tooth in the vicinity may fracture and may need to have the restoration replaced. In the lower jaw, we've got additional risks because of two nerves, two sensory nerves or perception nerves that pass in the jaw. One passes through the jaw, especially behind the back teeth again, and once that nerve leaves the jaw, it exits this hole here and supplies your lower lip and chin with sensation. There's also a smaller nerve on the inside, which is a soft tissue nerve, passing on the inside behind the back teeth, running into the tongue. On the lower jaw, we tell all our patients there's a very small chance of some change in perception, either in the lower lip area and chin area or the tongue area. These are pretty rare, less than 1%, and usually recover in any case. However, you need to be aware of this. The other risks are related to the recovery, and you need to keep your oral cavity as clean as possible and keep yourself comfortable.
Now, preoperatively, if you're having a treatment under local anesthesia, you can eat and drink normally, although it's recommended that you only have a light meal on the morning of surgery. It's a good idea to brush your teeth as usual, and then prior to the extraction, we will get you to rinse your mouth out with a chlorhexidine containing mouthwash. There's very good evidence that chlorhexidine containing mouthwashes, such as Suavacol, for example, decrease the bacterial load in the mouth and make an infection post-operative very unlikely. If you're having a treatment under intravenous sedation or general anesthesia, you should be fasting for 6 hours before your procedure. Now, in both cases, regardless whether it's local anesthesia or some form of sedation or general anesthesia, we will usually administer antibiotics preoperatively. There's very good evidence that, again, this helps with minimizing the risk of infection. Furthermore, there's good evidence that preemptive analgesia, so for example, 2 Panadine 4 tablets and 2 Nurofen tablets before your extraction, will decrease your analgesic requirements after the procedure.
After your procedure, you may have a ghost pack inside your mouth. We call these bite packs. If you have one of these, please leave it for 45 minutes to an hour and just exert light pressure on it. This will help to seal off any bleeding blood vessels and will prevent also you swallowing blood and thus feeling unwell after this. You often will be given a pack of extra gauze to be used if there's any oozing or bleeding afterwards. Use that again in the same manner, leaving the pack on the extraction side for up to an hour with gentle pressure. Should you need more than 2 or 3 of these packs, I think you should notify your proceduralist about this, and other measures may need to be taken. Apart from that, we recommend that you take regular preemptive analgesia, that is having painkillers even if there's no actual pain every 4 to 6 hours. There's good evidence that by preventing severe pain, you actually avoid severe pain. And sometimes people worry about taking too much, but by our recommendations, the dosages are in no way dangerous to you. The other very important part is to keep the oral cavity clean. And again, we would recommend starting mouth rinses or gargles with Savacol or similar chlorhexidine containing mouth rinse on the day after the procedure. On the day of the procedure, it's best not to rinse because sometimes the clot can be rinsed out and it could start potentially bleeding. Other simple measures are ice packs on the area of extraction. This will reduce swelling. Apart from that, please notify your proceduralist, be it a general dental surgeon or your specialist, if there are any other issues that concern you. Usually sutures, if used, are dissolving. Sometimes the non-dissolving sutures will need to be taken out about a week down the track.
Okay, so the next thing to consider is the effects of losing a tooth or multiple teeth on both your aesthetics and your function. The aesthetics is easy to understand, especially with a front tooth, but in terms of function, this is quite significant too. If you lose one or two posterior teeth or back teeth, then the load that the rest of your teeth carry during function will be greater. So I think you're placing your other teeth at greater risk long term by not restoring, by not doing anything after having one or two teeth removed. Furthermore, the bone which was there to support the tooth will invariably shrink or dissolve or resorb is the scientific term for it, following an extraction. Now, sometimes this happens slowly, sometimes this happens fast, but invariably, for example, if you leave the decision to have an implant or to have a bridge for 6 months, maybe a year or two afterwards, that's going to make restorative options more difficult because of this loss of bone. Furthermore, the back teeth tend to tilt and drift slightly forwards, and opposing teeth tend to over-erupt. So the space which is there once a tooth is lost will diminish over time, again making it more difficult down the track for your dental surgeon to restore this problem. There will also be consequences for your jaw joint. So the loss of a tooth or loss of multiple teeth has adverse consequences on the temporomandibular joint, that's the jaw joint, and increases the risk of TMJ or jaw joint dysfunction. There will also be consequences in terms of speech, in terms of chewing efficiency. So it's a good idea to consider what the next step is earlier on, even at this stage, as you're being faced with the possibility of losing a tooth.
Now that we have established that doing nothing is rarely a good option, it's probably the worst option, the simplest way of restoring a gap, for example a front tooth like this one missing, would be a partial plate. A partial plate or a flipper denture like this one has a tooth attached to it with a large wing that fits on the palate, for example here. So this would restore the tooth in this manner. This would be aesthetically okay, but it does cover a lot of the hard palate, for example here, places some pressure on adjoining teeth, and obviously is removable, and it's not very solid, so there's movement with chewing and it can be obviously pulled away. It is quite unacceptable for a lot of people to have a foreign body of this size in the mouth. It can cause decrease in taste, change in speech because of the bulk, and change of confidence as well, because you ultimately know that this thing has to come out and possibly reside in a glass on the bedside. The next possible option after a removable plate would be a fixed option. This would be a bridge. A bridge necessitates preparing the adjoining teeth to a shape that accepts the two crowns. This is not a bad option of replacing the missing tooth, because it essentially restores 3 teeth. However, it is best when the adjoining teeth, that is the teeth adjoining to the gap, are already heavily restored or damaged. If these are actually intact, it doesn't make any sense whatsoever to cut down the teeth to this extent, because it may even require root canal filling or other extensive therapies. However, again, if the teeth are needing restorations, this would be an excellent option to treat the gap. The next option, if we just remove this, would be an implant. An implant is probably the most modern and up-to-date treatment for missing teeth. An implant essentially means inserting a titanium fixture into the jaw, letting it heal to the bone, and subsequently the dental practitioner produces a crown that fits onto the implant abutment or the bit that protrudes from the gum. This is a very long-lasting restoration, can last 30 plus years. Some of the implants placed in the early 60s are still in function, and it basically achieves the most natural outcome for the patient, being able to chew and function as normal. In some circumstances, you may be losing the last teeth in an arch, or have lost these long time ago and be left with a rather unstable lower denture. Inserting 2 or more implants into the jaw will provide a great attachment for the denture, especially the lower denture, but in cases of upper denture it can be performed as well. And this would essentially allow the denture to anchor on the implants and become almost as good as natural teeth. Patients often report that they can again chew hard things like apples without any problems, whereas the denture before did not allow any chewing, or the chewing was very slow and cautious. This is a very excellent option for missing teeth, especially on the lower jaw.
The bottom plate was floating all the time. I had difficulty eating. I used to take, if I went out for dinner, I'd take an extra probably 20 minutes longer than anyone else to eat, and couldn't eat any apples or anything like that, and so I decided to get the implants put in, and since then it's been excellent. Oh yes, only it was excellent. It was only the top, from your shoulders up, that you around the jaw. That's all you could feel. It was excellent. I had no problem whatsoever. No after effects or anything. Nah, none whatsoever. It's just like as if I had the original teeth before the false plate.
So hopefully we've managed to alleviate some of your anxiety about your upcoming procedure. It does not have to be an unpleasant procedure. There's many ways it can be done, as we mentioned, either local anesthesia, which will be pain-free, or under sedation, or even general anesthesia if you feel highly anxious about it. The important thing is to be fully informed, and if anything is not clear, please contact your dental practitioner or your specialist before the surgery day.
By knowing your options and deciding the best option for you, together with your health practitioner, be it your dentist or your specialist, you can be back to normal in no time. You can be functioning normally and basically looking the same as before. So we hope that this was useful for you. Thank you for taking time to spend 20 minutes or so watching this video, and we wish you all the best with your procedure.
All the best.